Hi there, my name is Joe. I believe we met a couple of months ago down in Florida. Dan wanted me to come by or be on video to show you guys a little bit on how to apply the material again. If you remember, I think we went over the fact that you just need to cover it 50%. Of course, it's got an adhesive side and a non-adhesive side, and you want the adhesive side away from the skin. And I think the best way to start a cast for anybody of any age is what I normally do is I'll make a couple of slits in the material. This is the adhesive side. Flip that over so it tacks down to itself, and so that way you could lock it within the thumb, okay? So if your patient's kind of moving around a little bit, you don't have to worry about that material moving around too much. You can lock it in. Plus it gives you a little bit of extra padding around the thumb area, and it starts you off, I'm gonna put your wrist just a little straight, starts you off at getting a little protection around the thenar eminence. Bring it up, and I normally just cut it right parallel with the thumb, so it gives me a little bit of room to work. And you could bring it back through the hand. Again, cut parallel, and you could cut this as much as you want as long as you overlap it with material. And this material is very forgiving. You don't have to worry about the wrinkles and stuff. When you do cut this, try to cut it within the lines and not around, into the squares. It really doesn't matter too much, but just be kind of cautious of that. Again, this material is very forgiving, so I'm not going to worry about cuffs or wrinkles. What I'm going to do is just kind of give them a little push down and just bring it around. Now, the main thing about this material is you want to cover it 50%. As you can see, it's nice and white here. Where it's not covered here yet is kind of a grayish. So you want to just cover that 50%. And that would be all the material that you would need as far as coverage. And we'll continue down here a little bit. And then I'll show you the cuffing technique. There's a couple of cuffing techniques, but there's one that I think works fairly easily and quickly. And you want to keep some scrap material, because what scrap material is good for is padding up prominent places. But what you can do is you can take a piece of your material, give that a cut. As you can see, there's little ribs in through here, if you can see that. And you want to fold it right along the rib there. And what you could do with that now, I have non-adhesive here because I folded it over. Just bring that right around, and I have my cuff here, okay? So you have a nice cuff, so if you were to bend his arm up, it wouldn't dig into him. And you could do the same thing at the base of the fingers. Just need a shorter piece. Again, just fold it over the ribs. It sticks nicely. The nice thing about this adhesive is that you could use little pieces to pad up areas, and it doesn't migrate. So it won't move on you. You don't have to worry about introducing water or anything like that. So I have a nice cuff at the top and the bottom. The biggest area of concern most casts is around the thumb, where the fiberglass seems to rub most of the time. And this is where a nice little piece of scrap material like this comes in handy. Kind of just eyeball it, find the center piece, cut it about halfway up, and you want to fold it over so you have adhesive covered up. And what you could do with that is bring it up under the thumb and fold it over, so that way when you apply your fiberglass here and you bring the thumb down, it's not going to rub against the thumb. Again, you want to make it so that way that little, show you that again, that little butterfly, you have the adhesive covered, so when you bring that up around the thumb, you don't have any adhesive around the thumb. Now again, if you have somebody that's has a pretty thin arm, has a prominent radial and ulnar styloid, you don't have to wrap it all again. You could take little pieces like this and just cover those areas up. Again, the adhesive is so nice and sticks so well that you don't have to worry about rewrapping this to get sufficient padding. Then you apply the cast saw or cast stop tape to where you're going to cut your cast to split it. There's a couple of things you could do. If you want to see a little bit of the edge of it. If you don't want the frayed ends to show, you just make a little, fold that on top of itself, make a little cuff there with the material. And we're going to do the same on this side. and do the same here. Now, what I do is I try to get the seams of where I put the cuffs, like here my seams were where the tape is. So that way when you have the seams of the cuff, you have that tape holding down the cuffs also. Apply your fiberglass like you normally would, and then just check, make sure that it's well padded if the patient's not having any issues for you. I showed you the one technique of using scrap pieces as far as cuffing, where you would just fold over the edges and apply the cuff this way. Another way of doing cuffs, depending on the type of patient you have, and I usually do this for my non-compliant patients, is you can incorporate the fiberglass, or the AquaCast in with the fiberglass. And what you want to do is extend it out just probably to the PIP joint. So you have, and you want to go around 2 or 3 times, just like this. So you have enough sufficient padding. Again, I cut mine right where the tape, the blue taping will go. And so you have this here now, and what you can do is take your scissors, cut this back about 3 squares on each side. Put your first layer of fiberglass on. Once you've applied your first layer of fiberglass, you take the AquaCast material and flip it back, and then put your second layer of fiberglass on. And what this will do is will incorporate this material in between layers of fiberglass, so the patient, especially if they're non-compliant, will not be able to pull it out. And that's a good way to secure the material down, so that way they will not be able to take the material down. This is not going to affect the drying time. It's not going to affect the material as far as the water pulling and stuff. The water will still evaporate through that layer. All right. All right. Now we're going to start off with a long arm cast, and you position the patient according to your physician, but at 90 degrees, and you're probably, if you're watching this video, you're amongst the star right now, because not only you've seen them on video, but you're probably talking to them right now. But anyways, I start off the long arm cast just as we would the short arm cast that we showed you earlier. Take this and split this up a little bit, incorporate it in under the thumb, and just bring it around. Again, we just cut as we need. Try to cut between the squares. It's not going to affect the flow of the water if you do cut through the squares. Oops, excuse me. The water will still evaporate and drain out of this material. Again, we're not going to worry too much about puckers and wrinkles like you would other synthetic web roll material or padding. Get that 50% coverage and run it up. Now, the big question I always get is, how do you incorporate the elbow? If you feel comfortable and you want to go around the elbow, that's perfectly fine. What you can do is you could stop right here if you would like, and this is where we're going to use the, once we get this going, I'll show you how to use scrap pieces to pad your elbow up. There's a couple of things you could do now. Again, you could take and make your little square and start at the elbow here. Yeah, we're going to have our patient keep his arm at 90 degrees. And I'm not going to worry too much about incorporating the elbow at this time. So what you could do is just bring the material around. And I'm just going to give this a little split right here to help me maneuver it a little bit more. As you could tell, we're leaving the elbow alone for now, just to show you. Now, if you feel comfortable making a few cuts, and I'll show you on another demonstration how you can go around the elbow if you like, without having to make a stop. But what you can do is you could take those scrap pieces, and what you want to do is back them on themselves. So what you could do is take a one piece that's longer than the other, so that way the adhesive is not on the skin. So if you back it on itself, but you have adhesive on the ends, that will help you tack this down for you, okay? Can you see that okay? And you can do this as often, as much as you want, depending on the elbow injury too, or if the fracture is at the elbow, you want to check on the padding too, okay? And if you could see, I have some open space over here. Again, we're not too concerned with the open space because we could patch those areas up, but you don't want the adhesive on the skin. We don't know how the adhesive reacts to skin, but we know that this material, the AquaCast material in itself, would not cause any problems, okay? And you could even split this if you like to incorporate it into the elbow crease or find a place that you want that to go. So now you have enough padding incorporated around this, and you really use some scrap pieces on it, okay? So you don't need to worry about it too much, padding it up. I usually go around before I put the material on, just kind of give it a little pat. You could even take this and kind of flatten the wrinkles out if you see any wrinkles. You could apply cuff at the top and the bottom like we did previously on the short arm cast, either by using scrap material or by using extending out. Again, the thumb, you could use a butterfly material, the butterfly technique that I showed you, just by taking a small scrap piece and splitting that again and just making that butterfly and incorporating it under the thumb. Okay? How are we doing so far? Great. And nice and padded there. Again, if you have prominent radial and ulnar styloids or prominent elbows on the condyles, you could take your scrap pieces, again, that you want to save, and you can incorporate these in here. Again, the adhesive is so good that it will not migrate. So if he rinses this out well with water, these pieces will not migrate down. So you will have nice padding there without having to do this rolling 2 or 3 times. All righty. Now there's a technique, we do use this material in our ORs. And we use it for closed reductions and open reductions. But for as far as what we do, we'll apply a short arm cast, do our reduction, and apply the fiberglass and stuff. We will set this up to make it a short arm cast, meaning that once the patient is stable or the fracture is stable, then we're able to cut the cast down and have a short arm cast. Now, one thing that I failed to mention earlier is when you're doing the long arm cast, the material has a little ridges on the side. You don't want that in the crease of the elbow or even the crease of an ankle if you're doing a short leg cast or long leg cast. So what we do is we'll make a little cuff here using this material. So we're kind of setting ourselves up to cut this down because this material holds a fracture better than other synthetic materials, so we're able to sometimes just cut the cast down. So once we've done our short arm cast, applied our fiberglass, did the reduction, then we extend to a long arm. Now, again, you could stop here and use scrap pieces to make your long arm cast. What we normally do, again, just like we started at the thumb piece, I'll make a little, maybe even a little bit wider than I do at the thumb, and apply that into the elbow. Now what that does is gives me a little extra padding in the elbow, but it gives me a nice round edge, so when they have their elbow flexed up, it doesn't have a sharp edge in there. Come around, capture the elbow, and you can make this cuts either way you want to make you conform to the elbow a little bit, okay? Again, with this material being forgiving, you don't have to worry about where your cuts are or what wrinkles you have in there. Now, this is the long arm. We'll extend the long arm, and I will finish up the top like I did at the bottom. Again, just make your little squares or cut through your squares. Make a little box for yourself. Again, this adds a little padding, but it also helps you control the material better. And we will just finish this on up. Okay. Now, as far as what we do in the surgery suite, we will set this up. Again, what I did here is I put the cuff here, did this material, and we will add extra material. And what you can do is if you have those scrap pieces, kind of find where your center point is and just bring those up to the side of the arms. So that way you have padding at the elbow and you have padding on the medial and lateral malleolus. I'm sorry, medial and lateral condyles of the elbow. And then you can even add extra padding here. Now, when this patient comes in the office post-op, and you could apply your saw stop material also to make your cuts like you normally would on your long arm cast. You have enough padding here that you don't need it, but you could apply it here also. What we normally do when the patient comes in a few weeks post-op, if the fracture's healing and the physician says, the attending physician says, go ahead and convert him to a short arm, we'll say, do you want a new short arm or can we cut him down? And since we set this up for a short arm already, what we'll do is we'll make a cut along either side here, cut around here, pop the top part off, and you have a short arm cast. So you don't have to replace the whole cast because I've already incorporated the cuff here. So we're just taking this top part off, and these pieces you could just cut off. If you want to finish the ends with fiberglass again, that's fine, but usually the cuff is sufficient enough. So you want to set yourself up for a short arm cast, apply the long arm part on, and then cut it off as you need to.